Dr. Kaki, Jessamine, a lot of people are suffering from colds, viruses, flus. So let's kick off with some of the things that a lot of people are going through right now. I want to know, what are some of the common problems you're coming across, particularly with people coming to see you related to ear, noses and throats?
Yeah, we're back in cold season, aren't we? Obviously, the weather's colder right now, so people are picking up things that are associated with that. And the main sort of things that we're seeing are lots of sore throats, lots of different types of sore throats, which we can talk about later, runny noses, sneezing, and some people are often having other side effects with that, things that are affecting their ears, for example, things that are affecting their sinuses, that sort of stuff. So quite a lot of stuff in that area that's bothering people today.
Okay, and gailung or problems hair related to their ear, nose and throat, can sometimes they be linked to other health problems?
Yeah, certainly. I mean, obviously you can pick up more infections and illnesses if you're unwell generally, if you're run down, if you're very stressed, if you're very busy and you're not kind of necessarily paying attention to your health so much. So of course there is that chance that we can pick up more illnesses and infections, of course. Okay,
and you mentioned that there are different types of throat problems that people are going through right now, particularly with the weather change and a lot of viruses going around. So what are some of the ones that you're seeing on a regular basis?
Yeah, so I mean, there's over, as we discussed previously, there's over 200 different types of virus, and that can mean that people are picking up viruses left, right, centre and feeling very rubbish and run down by it. And of course, there's the common flu, which we've discussed in a previous episode, and that, of course, is lingering around still. So with all that as it is, it means that people are picking up either the bacteria or the virus type throat infection, and some of those are leading to sort of bad tonsillitis.
Okay, so now, so I know what a sore throat is. So sore throat is something where your throat feels a little bit itchy inside, it's hard to talk. But then what's the difference between that and tonsillitis?
Sure. Tonsillitis is probably more of a technical phrase for a sore throat. So a sore throat comes with upper infections of what we call the respiratory tract, the airways of the ear, the nose and the throat. So if you get a runny nose, sore throat, bit of a cough, that's, again, probably people call that a sore throat, but when they feel really bad with it, they call it tonsillitis. Actually, they're pretty much the same thing. Okay. But the thing about it is, as we said, there's viruses and there's bacteria. So the viruses cause that runny nose, sore throat, coughing and feeling unwell. But it's the case of the bacterial infections that can make you feel really unwell.
Okay, all right. We've had an email from one of our viewers at home. Do you know, a message get up before you came on the show just now? And I'm Ravina. Now, Ravina says, I want to know what causes sore throat. She says, I seem to be getting them a lot lately. She says that she's had one a few weeks ago, took some medication that she got from the pharmacy. She's been taking throat sweets. She said it went away. Then she says it seems to have come back and it doesn't seem to be going away. So what should she do? Should she be worried or should she just carry on doing what she's been doing so far?
Yeah, of course. So, I mean, general advice is always we expect people to be picking up coughs and colds all the time. Unfortunately, because there's so many viruses around, you get better from one, someone else around you gives you another one. Especially in the season we're in, people are out shopping, people are out socialising, you're meeting different people, lots of children, and they are spreading their viruses around. It's really when it's a bacterial one that we think, we as doctors, we may think we need to start antibiotics. And the signs of a bacterial one are slightly different to a virus one. So you may have things like a very bad sore throat, but actually not having a cough, a persistently high temperature, and also a painful sort of swollen gland. Those things are very common, and if they happen in bacterial infections, and if they happen, then it's the case of us saying, we need to have a look in the throat, see if there's pus that can indicate a bacterial infection, and then we need to give antibiotics.